Hi, folks. Today is March 27th, and just want to point out to start, I'm wearing my RiverWoods Exeter shirt, and I'm wearing a RiverWoods Durham hat, so a little bit of, my outfits don't match, but mostly because I was having a really bad hair day, and I wore my Birch Hill shirt earlier this week and haven't done any laundry, so I'll get back to that one next week. Few things we have going on here at Campus Crossing. One thing I want to point out to you all, we have a ton of moisturizer because I wash my hands about 10,000 times a day. And other very important item, anything with salt, kind of gets us through the day. These are, I don't know if you can see these, but there's caramels. But on a slightly more serious note, yesterday the governor issued his stay-at-home order. We've read through that in total detail. There's nothing new in there that tells us we should be doing anything different than what we were doing. In fact, I think we're probably more protective than what the governor issued. So that's good. We're happy that the governor issued that order because it allows, anything that requires us to have fewer people out, fewer people around one another is going to help us stem this tide. So we're very much in favor of it. A few things I want to just point out to you. I've been asked by a number of people, residents and staff, how long do I think this is going to go on, these measures? And the governor's order is through May 4th. I think that's somewhat optimistic. I'm thinking about this for myself anyway in 4-week cycles. And we are at the end of week 1 of the first 4-week cycle, where everything we're doing is about protecting our campuses and protecting you. And I think there's very likely going to be a second 4-week cycle and potentially a third. But we can do this. We're already doing this. We're adjusting. 2 weeks ago, when we started to think about screening our staff and making any changes and closing the dining rooms, those seemed like really big deals. And now they seem like a small price to pay. Every bit of data we're getting, everything I'm hearing from my friends around the country tells us that this is the beginning. And there's still challenges to be had for us. And everything we can do to keep the virus out of our communities keeps you safe, it keeps our staff safe and healthy, and it allows us the most freedoms. So that's everything we can do to do that, we will. I've been asked why we don't have masks on our staff if they're going out into the real world at night. And the answer to that one is that number of personal protective equipment, PPE, just doesn't exist right now. There is a global shortage of PPE. If you're watching the news, which my guess is you are, you know that. Turns out that most PPE was made in Wuhan, China, which is kind of unfortunate. So we're doing everything we can to source masks, to source gloves, to source any kind of PPE for our nursing staff. Those are the folks who they can't keep a 6-foot distance if they're providing direct care to our friends in assisted living and on the nursing side or memory support. So we need to protect them first. And for our folks who work on the independent living side, I just have such a huge thank you for all of our residents who are sewing cloth masks. They're not surgical masks. We're not going into the OR with those, but they are absolutely helping to protect you and protect our staff. And we'll start to share those with certain staff members who need to have some kind of protection or need to have some kind of shorter distance between them and other staff people or them and you. The last thing I want to say is, as we think about what's ahead for us, and we're trying to plan ahead, it's difficult because the world is changing outside of us and we have to keep adjusting to what we're seeing. And so that may mean that there will be additional operational changes in the future. What I can assure you is we'll tell you why we're making them, and we'll tell you what those changes are as quickly as we can. The reality is We just have to continue to be flexible. We have to continue to be nimble. We have to continue to pay attention and follow the regulations that we've put in place to keep you safe. To that, I just want to add one thing. We see a lot of flower deliveries from your families, which is beautiful and showing their love. If you could ask them not to do that, that'd be great, because it's just one more thing coming into the campus. What else can you do? Stay away from one another. I know you love one another. That's great. Love one another from 6 feet. Don't hang out in groups, or hang out in groups that are 6 feet apart and not large groups. Get fresh air, talk to your friends, but do everything you can. Wash your hands, by all means, wash your hands. But do everything you can to just maintain distance, maintain as much of your personal space as you can right now, because that's what's going to help keep us safe and healthy. So I'll end with that. Hopefully we can bring some happier messages. I will say this. There's so much going on that I'm proud of right now. Our staff in all 3 communities, at Birch Hill, here in Exeter, at RiverWoods Durham, just knocking it out of the park for you. They are so committed to your health and your safety. And they're committed to finding new fun ways for you to get together, for things you can access, whether via your computer or the TV channel, for ways you can enjoy one another, whether that's hallway happy hour, which would probably be my favorite, or hallway bingo, or there's some dancing going on from an appropriate distance. There's some interactions, just people getting to know one another on a different level, but from a distance. And that's really what community is about. We're finding new ways to do it. You're finding new ways to do it. And we're going to be okay. It's just going to take us a while. So hang in there. We'll be back with you next week. And stay healthy, my friends.